I'm Ruth Fox. I'm the Macmillan Skin Cancer Nurse Specialist in Northampton. Generally speaking, there are two types of skin cancer, melanoma and non-melanoma skin cancers. I'm going to talk about non-melanoma skin cancers. There are some rarer types of skin cancer, but generally the non-melanoma skin cancers are basal-cell skin cancer and squamous cell skin cancer. More than 90% of people who have basal cell skin cancers or squamous cell skin cancers are cured with various treatments. Individual cases of skin cancer are discussed in the skin cancer multidisciplinary team, and the best treatment for each patient is determined. Treatments for these type of skin cancers include surgery, radiotherapy, cryotherapy, which is a freezing treatment, photodynamic therapy, which your consultant can speak to you more about, or topical treatments such as cream to put on the skin.
I'm Judy and I live in Cambridgeshire. A few years ago I noticed a spot on my forehead just between my eyebrows. I went to the dermatology clinic and the dermatologist took one look at it and straight away said it's basal-cell carcinoma. The first thing that he said was it had to be removed because of where it was. It was very close to my eyes, so it had to come out. He explained about how there would be a 5 centimetre incision all the way around, and it was just a straightforward removal of the tumour. And I had another patch on my face that was treated with chemotherapy cream as well. But it took, I think, about an hour for the actual operation under local anaesthetic. I had quite a big scar at the time. It was probably about 5 centimetres, and a lot of stitches, internal and external stitches. And the scar started fading fairly quickly. I think I'm very lucky, actually, because of where it is, that it scarred badly at all. Although I now know the cancer I had wasn't a serious one, at the time I had 3 children. And you think the worst, you do. You start thinking about the future, and you don't want to leave the children with no mother, and you do have very morbid thoughts.
The main thing to remember after any skin cancer is good sun protection ongoing. Never allow your skin to burn. Precautions include a good wide brim hat, sunscreen of at least SPF 30, wearing close weave fabrics such as cotton or linen, and avoiding the hottest part of the day between 11 and 3. If you want a tanned appearance, it's much safer to use lotions or sprays than seeking out a sunbed or having too much sun exposure.
When I was a child, I was very lucky. We had a lot of time abroad, and I think at the time, we're talking about the 70s and 80s, we were lucky to have sort of factor 2 slapped on when you were at the beach, and I burnt. I'm very fair. I think I've got all the fairly red hair, all the traits of somebody who's very prone to getting skin cancer. I think you need to find a balance. I was very paranoid when I was first diagnosed. I kept out of the sun completely, and I didn't use any chemicals on my skin, and I was very, very paranoid, I would say. But you can't live like that. I cycle a lot, and in the summer I'm out on my bike 4 or 5 hours at a time, but I'll always wear long sleeves and I'll always wear a factor 30 sun cream. And I still enjoy the sun. I don't avoid it, but I don't lie in it either. I'm very careful.
These type of skin cancers are very curable, but if you have any concerns about a lesion on your skin, it's always best to seek medical advice. The earlier the better.